Hello, everyone. I hope you're all doing amazing. Imagine a young boy named Alex. He's 10 years old. And to most people, he seems like your typical kid. But his mother would describe him differently. Hostile, defiant, and even vindictive. Strong words, right? But they reflect the daily reality his family experiences. You see, Alex struggles to control his emotions, leading to everyday situations, into battles, outbursts, arguments, and a refusal to follow even simple rules. Whether it's his parents, teachers, or other adults, conflicts seem unavoidable. But this isn't just normal childhood defiance. What he's dealing with is called oppositional defiant disorder, or ODD. It's more than just the occasional temper tantrum. For him, it's a pattern of defiance that affects his relationships and the way he interacts with the world. Now, before we dive deeper into this topic, let me introduce myself. My name is Rayan Hadjar, and I'm a 13-year-old student from TEDxUniversity, currently in middle school. Public speaking has always been something I'm passionate about, and I'm excited to be here today to share a topic that's important not only to me, but to many families around the world. Like many teenagers, I have a variety of hobbies that keep me busy and engaged. Whether it's getting lost in a great book or staying active through sports, these activities help me grow and learn. Now, I want to shift my focus to this condition that affects kids like Alex. I was thinking, what usually causes ODD? Well, it's a simple answer. This behavior can develop from a mix of genetic, environmental, and psychological factors. Genetically, a family history of mental health issues can increase the likelihood of similar problems in children. If a parent or close relative has faced mental illness, the risk may be higher for the child. The environment also plays a significant role. Factors such as ongoing parental conflict, exposure to abuse, or even severe punishment can affect behavior. Psychological factors are crucial. Children who struggle with managing their emotions, act impulsively, or get easily frustrated are more at risk. Now imagine a child struggling every day, not just with schoolwork, but with something deeper that affects how they interact with the world. In class, they may find it hard to focus, not because they don't want to learn, but because their emotions often get in the way, which can lead to conflicts with teachers and classmates. Now imagine the frustration of constantly being misunderstood, which can slowly chip away at their confidence. And as these kids grow more anxious and isolated, feelings of depression can begin to take hold, making them feel like they're alone in their struggles. Now, picture what happens when they go home or they come home from school. Home, which should be a safe place, becomes another battlefield. Arguments with parents and siblings might become a daily occurrence, further increasing their emotional stress. These kids aren't just being difficult, they're carrying a heavy burden that most people don't see. So to tackle these challenges, many effective treatments can make a significant difference. One powerful approach is CBT, cognitive behavioral therapy, which empowers kids to manage their anger and discover healthier ways to express their feelings. Another impactful method is PCIT, parent-child interaction therapy, which is designed to strengthen the bond between the parents and their siblings. Simple as that. Now, I know parenting a child facing these challenges requires a thoughtful and consistent approach. Establishing clear rules and consistently applying consequences can provide structure and predictability, which can both be comforting and guiding. Focusing on positive reinforcement is crucial. Rewarding good behavior encourages more of it, rather than solely reacting to negative actions. And it's also essential for parents to avoid imposing demands on their child. Instead, offering choices and making them involved in decision-making can lead to a more positive outcome. Now, no matter how hard they may seem, remember that every individual with a mental health disorder has unique strengths and potential. With your consistent support and and understanding and patience, you can help them navigate their difficulties and thrive. Thank you, everyone.